is director of the MRC Centre for Global Infectious Disease Analysis at Imperial College London. He advises government, and it was his modelling which is thought to have led the government to impose a nationwide lockdown back in March. Good morning to you.
Good morning.
And here we are again on the cusp of another lockdown. Was this inevitable, do you think, or could we have avoided this?
I think we did everything we could to try and avoid it, and the Tier 2, Tier 3 measures certainly did have an effect. They slowed growth of the epidemic in the last few weeks, but unfortunately just not by enough. So critically, the epidemic was still growing despite those measures, and eventually that would mean December timeframe that the health service would start to get extremely stressed. And so I think, yes, it was inevitable that these sort of measures would have to be introduced, as we have seen now in France, in Italy, in Germany.
So you said despite those measures, and you were talking about the tiers, for example, if we look at the different measures that have been employed to try to keep coronavirus levels down, social distancing, personal behaviour, responsibility, tiers, mask wearing, all that kind of stuff. Does it mean, well, test and trace as well, does it mean that if all those things were done correctly, we wouldn't be where we are just now? Or were they never enough?
This is a very, very difficult disease to control transmission of. I mean, it's highly transmissible. If we were doing nothing, if we were back in February, then every case would generate 3 others, the R is 3. And that means you have to reduce contacts in society by at least 2/3 below normal levels to achieve control. And we think, Tier 3 measures may have reduced them 60%, but 60% isn't quite enough. Lockdown in March, when we were all in our homes, schools were closed as well, that achieved about an 80% reduction. We got R down to about 0.6. We're hoping that this new lockdown will get it down to something like 0.8, maybe 0.9. It won't be quite as low as it was back in March, because schools are still open, universities are still open, and we have so-called social and childcare bubbles. But if we can get it below 1, we can get the infection numbers down, and they'll go down hopefully over that 1 month, maybe by as much as 50%, and that just gives the NHS more breathing room.
Yeah, we'll come to schools in a second. I just want to clarify all the figures there because they're fascinating. Back in March, you said that our rate was around, we think it's around 3?
Before the lockdown was introduced, yes, around 3.
And it went down to 0.6?
Yeah.
This time we want to get it down to 0.8. From what? Where are we currently? Because it's much lower, isn't it?
Yes, so the measures are having an effect at the moment. It varies from place to place across the country. Merseyside, we think, is probably down all the way down to 1.1. They have the most draconian measures short of lockdown in place, but still not below 1. It varies between about 1.1 and 1.6, 1.7 across the country at the moment.
And the average would be, roughly?
It's about 1.2, 1.3 probably averaged across the country.
Okay.
Which is let me translate that into kind of more meaningful. It means admissions to hospitals, beds occupied in hospitals with COVID patients are basically doubling about every 15, 16 days at the moment.
Right. So to get it from 1.2 to 0.8 feels, I don't know about you, but people listening, feels to me doable because we got it from 3 to 0.6. So to get it from 1.2 to 0.8 feels doable. Do you know over what kind of period of time? Is this going to take another 3 months?
So that should happen, the actual reduction in the R should happen basically as of Friday. I mean, if people reduce their contacts as we expect them to, then that will be immediate. But it takes time for it to filter through into reduced admissions to hospitals, reduced deaths per day. That will take time. So it'll take us probably 2 to 3 weeks to see an effect on numbers.
Would it be helpful to close schools?
I think it's always a balancing act. From a purely epidemiological perspective and getting the transmission down, clearly it would reduce transmission, but you have to counterbalance that with the harms closing schools do, and that fundamentally is why we have politicians making those judgments.
What about this idea of relaxing the lockdown in England over Christmas if England is still in lockdown at Christmas? Do you think that is a sensible idea or not?
It very much depends on how effective measures over the next month or however long they're in place are. If we can drive infection levels down substantially, then we'll be in a better position to relax things over Christmas than if they're still at the current levels. And so it's very difficult to anticipate. Relaxation will inevitably pose some risks. It will lead to more transmission. But if that's from a low baseline level, the costs of that and the harms it causes are going to be less than if we're at the current levels.
Right. And just finally, on the idea of going into lockdown, coming out, and then perhaps having to go in again, is that, do you think, what's going to happen? I understand that when we come out, when England comes out of lockdown, they'll go back into their separate tiers, so some restrictions will still apply. But if we want to avoid going in and out of lockdown for a while, presumably we need things like, obviously we need a vaccine and we need test and trace to be better than it is. Is that fair to say?
Yeah, so I think the vaccine, we're really talking about, spring of next year, but optimistically before we have significant numbers of doses. I mean, we always anticipated that one outcome of this pandemic, and this is talking about back in March, would be on-off measures. Clearly, in some ways, it will be better to find the perfect set of measures to keep transmission under control without needing to go in and out of lockdown. But that's actually a very difficult thing to do. Our understanding of transmission is limited, and we can't always predict human behaviour. So we inevitably have to tune measures as we go along. So, I mean, it is quite possible, unfortunately, that we may have to revisit this again come early January or something. I very much hope we don't, but I think everybody you have spoken to says, I mean, we have to see what the data shows in the next few weeks and adjust policy accordingly.
And I must ask you finally, actually, about the counter-argument to the lockdown, of course, which up to possibly 40 Tory MPs are willing to vote against the government. There are many people who subscribe to the view that national lockdowns impair the nation's health more because they lead to suicides, they lead to missed appointments, and they lead to businesses closing and the loss of livelihoods. What would you say to people who feel that national lockdowns are not the answer and never are the answer?
So I completely understand. I mean, lockdown has huge harm on the economy, has health consequences and many other things. But I think, as Prime Minister said over the weekend, we need a functioning health system. We cannot allow the health system to be overwhelmed by COVID patients, because that leads to even greater harms, not just not being able to treat COVID patients well, but not being able to treat anyone well. And so I think, this government is not a government which reaches for these measures easily, and would only ever do so if it was absolutely necessary.
Well, thank you for talking to us. That is Professor Neil Ferguson, who's the director of the MRC Centre for Global Infectious Disease Analysis at Imperial College London. You'll remember his name.